what are the risk factors, how we can identify, and what are the, what I should say, like tumor markers or whatever you would like to call it, so that the person is aware that she or he is likely to get, or in an initial, so that they can take the best care.
Correct. So normally what we do is, for that the person has to first come forward. They have to come and meet the oncologist, not any other doctor.
Correct.
So once they come to me, what I do is I take a proper family history. I'll try to see how many people in their family had cancer, what type of cancer they had. And every cancer has a certain genetic mutation, that is genetic damage. So once I feel the risk is more, we collect their blood sample and then we send it for a genetic testing. So usually the report takes about 21 days time, and we check for not only that particular cancer, we check for the gene which can cause all types of cancer. Suppose if the gene comes as positive, then what we do is we tell the patient that you are a very high risk candidate, and we put them on regular follow-ups. Follow-up scans will be done. For example, we can do a mammogram, ultrasound or MRI scan, and then we give them some tablets also to prevent. There are, yes, for breast cancer we put them on a tablet for certain years, and we put them on a regular follow-up. And if any cancer, if there is any risk of coming back again, then we advise the treatment part. So it is very important that when a genetic testing is done, at times you can prevent the cancer.
I see.
And the testing is very simple. All you have to do is just give a blood sample, and so that the rest of your life you can live peacefully without having any tension. I have a lot of patients where even doctors, they call me up from other cities saying that my father died because of liver cancer, my mother died because of breast cancer, and they are with so much of anxiety and depression because every day they think that something goes wrong, they think it's a cancer. So I tell them clearly, if you're so worried, get a genetic testing done, and that will give you a clarity.